Okay, so first I'm going to ask you to take a good look at what you see over here, and you'll notice that you see something that's similar to or what resembles an infinity sign. So it starts quite small and then it gets bigger and then bigger and bigger. So once you put these special glasses on, they're filters. One side is green and one side is red, and I'm going to just ask you to close one eye. And you'll notice that half of the lines disappear.
Yes.
And then if you open that eye and close the other one, you'll notice that the other half disappear.
Oh.
So in order for us to do this activity, someone as young as 3 years old or someone as young as 90 can do this activity quite easily as long as they're using their two eyes together. So someone who would find this activity quite difficult is if they are only using one eye at a time, so they don't know how to use both eyes together.
So what would that tell you then, Julie, if I can't see the difference? Does that tell you something?
So if you tell me you're looking at this with the glasses on, you haven't closed any of your two eyes and you have them both open, but you're noticing that some of the lines have disappeared, so you only see half of them, then I know that that we have a weaker eye that we need to work on and we need to really focus on, and we probably need to do a lot of activities like this to encourage the brain to want to use two eyes together at the same time.
Okay, I see.
And as we talked about on the show, that's related to neuroplasticity. And for all of our listeners out there and viewers on Facebook, neuroplasticity is good for seniors too. It doesn't matter how old we are, our brain can change. It just takes effort and therapy like you're doing.
Exactly.
Yeah.
It takes lots of training to get to that point, yes.
Okay, do you have another trick to show us?
Yes, so that is
Not a
more
trick, a
working,
therapy.
Yes, so there's another one like this, but now this is another filter. These are polarized filters that you can put on. One side is polarized vertically and the other side is polarized horizontally. So it's very similar to blinds that you have on the windows.
Okay.
And what we have here is, if I just could borrow a piece of paper, some print.
There you go.
So if you take a look over here, you'll also notice that if you close one eye,
Okay, the lines disappear.
exactly, and if you close the other one, the other set will disappear.
Yes, they did.
So again, this is very similar to this red and green glasses exercise. We're trying to encourage the brain to use two eyes together at the same time in order for you to be able to successfully do this activity.
So if I can see two and then not two, are my eyes working together?
So if you can see with both eyes open, and you can see all the words and none of the words are blurred or
Right.
anything like that, that means that you do know how to use two eyes together.
Good for me.
Well
Yes.
done.
Congratulations to I.
Quick question, just to finish up the video. Clearly, that's not the way all people. Liz is lucky.
Right.
How often do you see? I mean, is it very prevalent?
Well, most of the people that come to see
Yeah.
me usually have a visual difficulty,
Right,
so
right,
it is quite prevalent to see this, or they may not have difficulty necessarily seeing both of them together at the same time, but they just may not have the control. So, some of the difficulties that they will notice is that, they can see it, but it's not clear.
Right, okay.
But what I loved about this exercise is that how do we know? We don't know what we don't know.
It's true.
So coming to see your optometrist, this is Healthy Vision Month, Dr. Teskey's going to be on the show in a minute, seeing and making sure our eyes are a window to our health and even to our lifestyle. And so we don't know what we don't know. By doing that, you've just learned something new about your eyes from that perspective.
And it didn't hurt.
Right.
And it was easy. And sometimes we get nervous when we go to eye test because we think it's a test. Or we pass or fail, right? So this was easy. It was good stuff. So thank you, Julie. That's for me.
So for all of you out there, please be sure to share this video. And if you want more information about vision therapy, of course, you can check out Align Your Vision with Julie Yim. And of course, you can go to Dr. Carolyn Teskey and Associates to find out more information. And of course, makingourseniorsmatter.com, because we'll have it all there for you.